An unfortunately all too common way to lose your autonomy and stop living before you die, and to die sooner and more painfully, is to suffer an osteoporotic fracture in your old age. The time to prevent that from happening to you in your 80s is right now. And it's not about calcium, vitamin D, or even bone mineral density. Most of what you've heard about bone health as you age is wrong, or at least not enough. Let's change that, because the world needs you to show up more as you get older, not less. You're listening to the Health Courage Collective podcast, episode 230, What I Didn't Know Before About Building Bones That Don't Break. Welcome to the Health Courage Collective podcast, the show for women who are too busy to slog through hours of generalized, inapplicable, and often contradictory health information, but too smart to ignore that a few minutes of focused attention now can prevent years of suffering in the future. I'm your host, Christina Hackett, a pharmacist who doesn't want you to live on prescriptions, a certified coach specifically trained to maximize your potential, and a compulsive learner obsessed with preventative, cutting-edge, holistic, and integrative medicine. I'm on a mission to increase your physical and mental resilience so you can fearlessly look forward to your next 40-plus limitless years. Your time is now. Let's go. Hey, and welcome to today's episode. I'm so glad that you're listening today, and I hope that you've had a lovely week. Have you practiced AI, as in appreciative inquiry, this week? I think it's so powerful to spend some of your precious energy on scaling your successes rather than wasting it all on trying to fix your problems. Let's investigate what's going well and do more of what we're good at and is working well instead of always thinking we need to figure out how to change everything. If you'll indulge me on a brief detour, I promise we'll get back to why this helps you not have to stop living before you die in just a minute. So earlier this year, for our 23rd wedding anniversary, my husband and I went glass blowing. Have you ever done this or watched it being done? I've been to a number of glass blowing studios on various vacations over the years, and I always find it very fascinating. My youngest son was obsessed with the show Blown Away on Netflix for a while. Well, I guess until he watched all the episodes. We made 2 rocker cups and a decanter. So they're drinking glasses that aren't flat on the bottom, so they rock around and stay upright. They're swirls of clear glass, white and light blue, and they're very pretty and so fun to make, but way hot, like 2,600 degrees hot. We learned a lot about glass while we were crafting our glass creations. So you gather your molten glass from a furnace, and then you do your shaping steps and stick it back into a glass blowing furnace every so often to keep the glass hot enough to still be pliable and blowable as you work. When you're all done with your shaping, the glass stops glowing red, so you might think it's not that hot, but it's still around 900 degrees. And if you were to touch a piece of paper to it, the paper would instantly light on fire and burn up, which I've seen happen. Pretty cool. When you're done, you don't just leave your lovely glass creation out on the counter to cool like a pan of brownies. It has to be annealed in an annealing furnace or annealing kiln for a prolonged period of time. The glass has a bunch of internal stress going on from being hot and manipulated around, so rapid cooling from just leaving it out would make it crack because the outer layer would solidify and harden faster than the inner layers would be able to cool. So that tension between the outer rigidity and the inner incomplete state change results in breaking. I think our gaffer, our glass-making expert who helped us, her name was Sky, told us that the annealing kiln that we put our glass creations in would hold them at 900 degrees overnight and then slowly lower the temperature over the course of like 12 hours or something. I don't remember for sure, but it's pre-programmed to hold for a certain amount of time, then very slowly decrease to room temperature because you need strength throughout the glass, not just in the outer layer. We keep our glass set that we made on a shelf in our living room. We could carefully drink from it, but they told us not to put hot beverages in it and not to wash it in the dishwasher. We would never treat it the same way that we do the rest of our drinking glasses, which just came from IKEA. We wouldn't put it in the yard or display it on a busy city street or something. Have you been lucky enough to see any Dale Chihuly glass sculptures before? They're so So cool. There's one in the Symphony Hall by me, so I can see it whenever I go there. As much as I'd want everyone to benefit from the beauty of one of his sculptures, you would never put it in the town square the way you would a giant stainless steel bean or a bronze Joseph Stalin or something. It's too fragile to survive the everyday stresses of a normal life environment. You wouldn't even want to have it in a shopping mall that's protected from the weather. Too many people and too many variables. Even owning one yourself would be a little stressful. What if you accidentally bumped it? And how could you safely dust it? One of the biggest risks to your independence and confidence and ability to do what you want to do as an older woman will be the resilience and strength of your bones. Elderly people with osteoporosis are kind of like ticking time bombs. Many times they're too fragile to be left alone, and the enjoyable activities that we all take for granted are too risky for them. Their opportunities are drastically limited by the fact that any tiny thing not going their way could result in a catastrophic fracture. The word osteoporosis literally means porous bone. Your bones have little empty spaces where it should be solid. Osteoporosis is a risk for everyone as they get older. It's very common, but can absolutely be prevented or drastically delayed. If you don't want to be so delicate that your children have to encase you in bubble wrap and anxiously stand guard at all times, the time to implement an effective, and honestly not that hard, strategy is right now. While everyone can and does lose bone strength and resilience with age, women over age 50 have 4 times as much osteoporosis as men. By far, the highest risk of osteoporosis is in white and Asian women, very thin women, and women who went through menopause early. It seems that the biggest risk for bone fracture is in the vertebra and hip. In 2023, there were 10 million hip fractures worldwide. 70%, so 7 million of them, were in women. 70%. 25% of hip fracture patients die within a year. And women usually get hip and vertebral fractures 5 to 10 years earlier in their lives than men do. A study in Denmark from 1977 to 2001 showed that those who broke hips compared to age-matched controls were twice as likely to die over the next 5 years. A study of 7,512 women in France showed that those with hip fractures were 4 times more likely to die within 4 years than age-matched controls. In Sweden, a study of 3,000 women followed for 22 years showed that 21% of those who fractured a hip died within 1 year, compared with 6% of the age-matched controls. And risk of death was more than double that of their age-matched controls over the next 10 years. Women over age 80 who fracture a hip lose 38% of their previously estimated remaining years of life. That's why breaking a bone when you're older is such a big deal. And maybe worse than that, hip fractures can be excruciatingly painful. So if you don't die right away, you might be in huge amounts of ongoing pain. And vertebral fractures can also be painful, and they can cause you to lose some height and that upright posture that you need to have a good sense of what's going on in the world all around you. Everything takes longer to heal when you're of an advanced age, so the pain will probably linger longer and your mobility will most likely be decreased, probably permanently. You know, I love harping on how your biggest asset you can bring with you into your old age is a lot of muscle mass. And muscle strength and bone strength tend to be dance partners, but if you're on the normal trajectory of muscle loss as you age, 4% per decade after age 30, then 3% per year after age 60. If you have a hip fracture and are immobile for several weeks or months, you'll lose a huge percentage of muscle mass in just a few weeks or months. And suddenly you'll be way biologically older in just a few weeks because you lose all that muscle mass from having to be down and out. Osteoporotic fractures are a huge cause of having to stop living before you die. Your quality of life and ability to take care of yourself diminish rapidly when your bones aren't resilient enough to live the kind of life that you want to live. Somewhere around half of women in their 80s have osteoporosis. Estimates come back between 40 and 70%, which is a ridiculously big range. Whatever the true numbers are, you have an extremely good chance of being in the 30% who don't. Why? Because you're thinking about it right now. You can give your 80-year-old self the biggest gift ever by taking care of your bones right now. And it's not $220,000, which is the cost of setting yourself up to be cryogenically frozen after you die. It's not even very difficult or time-consuming. I'm not a fan of the bisphosphonate bone density medications. That's a subject for another day, but unlike bisphosphonate drugs, the side effects of the small investments you can make in your bone health today are all good, like improved metabolism, brain function, mood, and just general quality of life. If I asked you to tell me what you think are the things that would preserve your bone health, what would you say? I think most people think first about calcium. Probably because of all of those milk mustache ads that we grew up with where they talk about milk being good for your bones. Maybe you would remember vitamin D. Those are pretty low leverage things. There's so much more to it than that. In episode 127, we talked all about bone density and the factors that go into it, including magnesium, strontium, boron, and my favorite, vitamin K2. I think that's all valid, so that's a good one to go back to and listen to if you care about your bones. But I'm just starting to realize and appreciate that there's a lot more to functional bone strength than just bone minerals or even bone mineral density, which I always thought of as the ultimate measure of bone resilience. Turns out that it's not. What? It's no surprise that our bones are living structures that are constantly changing. We have osteoblasts that build bone up and osteoclasts that break it down. Both are necessary, but after age 30 or 40, our osteoclasts tend to break down a little more bone than our osteoblasts are building up. For men, it's a slow and gradual decline over time. For women, the decline around age 50 is much more sudden and problematic. Why? Yes, the rapid drop in hormone levels causes a rapid drop in bone strength. Both estrogen and progesterone stimulate bone growth and inhibit bone loss in a healthy young person kind of way. Your bones aren't just compressed calcium like a calcium tablet or a Smartie made of minerals. Thank goodness, because Smarties are pretty easy to crush. Calcium and other minerals are deposited in and on the osteoid, creating the outer shell of the bone, becoming cortical bone. We do want this shell to be strong, so it melts in your mouth, but not in your hand. It shields the inner bone and helps with load bearing. But we also have internal osteoid without the same amount or kind of mineral deposit density that has a lot of stuff, including collagen fibers that provide a kind of tensile strength that helps the bone take on a lot of force so that it can bend a little bit without breaking. Kind of like being earthquake proof. An increase in minerals, including calcium, can strengthen the mineral density and stiffness of the outer shell, but doing that alone actually decreases the bone's flexibility. As we age, the thick, elastic collagen fibers inside our bones get thinner and more brittle, making the tensile strength or ability to bend a little bit as they sustain a force lower. The lower your tensile strength, the more likely your bone is to snap instead of bend under pressure. So that's not good. Even with a high bone mineral density, if you lack that resilience, that ability to bend a little bit, you're at an increased risk of fracture and all the quality of life ending consequences that come with it. You need both resilience and density, but the only good test we have is to measure bone mineral density. That's my favorite thing I talk about all the time with DEXA scan. I'm still a huge fan, but it's not the full picture for bone health. The only real way we have to measure your bone tensile strength is to bend your bone until it breaks and see how much force that took. Okay, so I've been recently watching a ton of this show called Poldark. Have you heard of it? It's set in England around 1790, and these people have a baby that they name Valentine, and he has rickets. And the dad, who probably isn't the biological father, but he doesn't know that yet, is super embarrassed that his son has rickets, and the doctor recommends keeping him in a dark room, which is sadly hilarious. The 98-year-old great aunt calls the baby the crooked maggot. Anyway, rickets is osteomalacia, which is a deficiency of bone minerals. The bones don't have a strong enough outer shell, so they bend, and the children with rickets get a bow-legged bent shape usually, which is why she calls them the crooked maggot. Osteomalacia, rickets, is usually from a deficiency of calcium, magnesium, boron, strontium, or more likely a combination of all of those, or vitamin D deficiency, because vitamin D directs those minerals where to go, which is why keeping a child with rickets in a dark room is a terrible idea. That doctor also bleeds everyone all the time as his treatment of choice. So the reason this matters, other than Poldark family drama, is that Dr. Fuller Albright points out over the years, many people have started to conflate osteomalacia, which is rickets, with osteoporosis, which is entirely different. Rickets is a lack of minerals in the hard outer shell of the bone, and osteoporosis is a lack of resilience within the soft inner matrix of the bone. And most of us treat osteoporosis like rickets, not with bleeding, thankfully, but thinking that more calcium and vitamin D is going to solve the problem. Nope. It's possible they could increase the mineral density of the outer bone, but they will not improve the inner resilience and ability to bend a little bit without snapping. Calcium and vitamin D are absolutely essential for bones, but their importance to your bone health and their ability to improve your bone strength decrease over time. As a child and adolescent, getting adequate calcium, vitamin D, and other minerals like magnesium, boron, and strontium does improve the current construction of your bone structure. Your bones are building up, and you need that raw material. But after adulthood, you do need an adequate amount to maintain your bone structure, so you still need that stuff. But getting supraphysiologic levels of minerals isn't going to correct the problem of loss of bone resilience inside the bone matrix. Postmenopausal osteoporosis is not a calcium deficiency. I'm all about vitamin D, and I think it's good for you, and there's a high probability that you need to take some. But postmenopausal osteoporosis is also not a vitamin D deficiency. A study of 51,145 older adults in China taking either calcium alone, vitamin D alone, or calcium plus vitamin D showed that none of them were associated with a lower risk for fractures. A U.S. study in 2022 of 13,085 women aged 55 and older showed that those taking vitamin D had no difference in fracture risk from those not taking vitamin D. There's nuance to all of this. They don't report the doses taken or other potential risk factors like taking proton pump inhibitors for heartburn. And nobody's talking about the critical importance of vitamin K2 or what anyone's magnesium, strontium, and boron levels were. All of that stuff still matters. It's just not the whole picture, or even the most important part of the picture. There's a book called Aging Bones, A Short History of Osteoporosis by medical historian Gerald N. Grobe, who says that he believes bone density is not an accurate measure of fracture risk. This is not something I've ever thought before. He talks about how fluoride dramatically increases bone mineral density, but also increases your risk for fracture because it decreases tensile strength, making your bones more fragile. He believes that the focus on osteoporosis and bone mineral density scanning all the time came about because the pharmaceutical companies had drugs that could increase bone mineral density, and the more people they could say, you have low bone mineral density, to the more drugs they could sell. Not because it actually helps anyone. I'm generally pretty pessimistic about drug companies, but that one's still a little hard for me to believe. I think there are good people who genuinely want to decrease fractures in the elderly. He does say, though, that the bone mineral density scoring system of Z-scores, a Z-score of negative 2.5 means osteoporosis, is all just made up, which I totally believe. It's a comparison between individual people and was never intended to be a criterion to initiate prescription drugs. That makes sense to me. But that is exactly how it's used now, unquestioningly, but with no basis in fact. Then he goes on to describe the even further lunacy of how if negative 2.5 is bad, then negative 1.0 and more is pre-bad, the way a puppy is a pre-dog. So the term osteopenia was invented out of nowhere. It's not a real thing. Even the World Health Organization says osteopenia has no clinical significance and does not have any correlation whatsoever to fracture risk. It means nothing. But that's not what marketers and drug companies want you to think. That's not what I've ever thought before. Once the DEXA scan Z-score of negative 2.5 became the diagnosis of osteoporosis and reason to start drug therapy, DEXA scans increased and prescriptions for bisphosphonate medications skyrocketed. Bisphosphonates are now prescribed for both osteoporosis, meaning a Z-score of negative 2.5 or lower, which was never meant to be the indication to start drugs, and osteopenia, which isn't even a real thing. This is all according to this medical historian Gerald Grobe. Bisphosphonates like Fosamax, Actonel, and Boniva have a big list of disadvantages, including that they increase your risk for fractures if taken for more than a few years. They eventually make your skeleton more fragile by impairing your ability to repair micro cracks. Not to mention that they can cause osteonecrosis of the jaw, which I have seen 3 patients over my 2.5 decades of pharmacy practice who developed that, and it's super crazy scary. And a bunch of other things like eating away your esophagus, damaging your kidneys, and causing muscle and joint pain. There are a few cases where they are necessary to take for 1 to 3 years because they do prevent bone density from getting worse, but overall, being able to avoid them is for sure the ideal. So, if calcium, vitamin D, and bisphosphonates are not the best thing to protect your bones, what is? We're going to get to that next week. Thank you so much for listening today. I care about how strong and fracture-proof your bones are going to be 40 years from now because the world needs you to live more as you get older, not less. Next week, we'll get to part 2. Until then, take advantage of the best time to prevent osteoporotic bone fractures, which is right now, and don't be normal. Thank you so much for tuning into the Health Courage Collective podcast. I am truly honored that you have paid me the enormous compliment of your time and attention. I would be so grateful if you would share this podcast with someone you know and subscribe so you never miss an episode. This podcast is for entertainment and information purposes only. Statements and views on this podcast are not medical advice. This podcast, including Christina Hackett and producers, disclaim responsibility for any possible adverse events by use of information contained herein. If you think you have a medical problem, consult a licensed physician.